Today I'm going to be talking about anxiety disorders. So the cause. Anxiety is defined as a normal reaction to stress. Every person has some sort of level of anxiety. The cause of anxiety disorder can be inherited or from a traumatic life experience. People believe that life experiences such as traumatic events appear to trigger anxiety disorders in people who are already prone to anxiety. People who have a high anxiety sensitivity are more likely to have a panic attack when put under stress. Cells affected. Cells can store emotions and memories, therefore affected each time anxiety is triggered. When a person feels fear and anxiety, the body secretes stress hormones by sending neurotransmitters. These neurotransmitters bind to a specific membrane receptor and cause chemical changes within a cell. Tissues affected. Stress can cause the skin to have acne, blisters, psoriasis, breakouts, and eczema. The picture to the right, you can see severe blistering and acne from stress. This happens from the release of pro-inflammatory cytokines, such as a stress hormone. If a person can't manage their stress, neuropeptides are released, causing changes in the skin tissue. Organ systems affected. The respiratory system. It makes it harder to breathe and can cause hyperventilation. In some cases, happens during panic attacks. Cardiovascular system is affected by the increase of heart rate, a harder contraction of the heart muscle, and in some cases, it can even cause hypertension. The endocrine system affected by the hypothalamus signaling the nervous system and the pituitary gland. They then produce epinephrine and cause cortisol, which causes the liver to make glucose. This can cause permanent damage to your kidneys. Gastrointestinal system is affecting the esophagus, stomach, and the bowels. It can cause one to eat more or less, causing heartburn or acid reflux. Sometimes can cause ulcers if worry is great enough. In some people, it could cause obesity. Here you just see a picture of example of a stomach ulcer, basically just a breakage in the stomach wall. Then over to the right is acid reflux, just showing you that the liquid in the stomach creates a reflux and it gets up into the esophagus, causing acid reflux. Continued here would be the nervous systems affected by having a direct role in the physical responses from the autonomic nervous system, sympathetic nervous system, and the parasympathetic nervous system. Examples of that would be sweating, shaking, and having a heart rate rise. The reproductive system is affected by the body producing excessive amounts of cortisol, which can affect the biochemical makeup of the male reproductive system. It affects testosterone and sperm production, and it may cause a woman to go through menopause early. It could cause sudden PMS symptoms or sudden stop of PMS symptoms in women. Signs and symptoms of a generalized anxiety disorder would include restlessness, feeling wound up, fatigued, difficulty concentrating, irritability, muscle tension, difficulty controlling worry, and sleeping problems. Signs and symptoms of a panic disorder would be sudden and repeated attacks of intense fear, may cause hyperventilation, feeling of being out of control, may cause dizziness, intense worry about when the next attack will happen, and fear of being in places where the panic attack has occurred. You may even faint during a panic attack. Signs and symptoms of a social anxiety disorder would be feeling highly anxious about being with other people, speaking in front of people, being in places where there would be a lot of people, feeling very self-conscious, being worried of being humiliated, being worried of being judged, worry for days or weeks before anything does happen, staying away from places where there will be other people, hard time making friends, and may feel nauseous when around others. Treatment and prevention would be exposure therapy. This is where they would expose you to your anxiety, try to find the cause of it, and maybe prevent it and try to help you recognize when your anxiety is coming on. Cognitive behavioral therapy is just basically therapy that focuses on your behavior. Support group or self-help groups. Stress management would be such as meditation, keeping a journal, talking to family members. Medication would be the last step that they would use for treatment. And 3 normal ones that they give out would be antidepressants, anti-anxiety, and beta blockers. The consequences in a short term would be difficulty swallowing, dizziness, rapid heartbeat, rapid breathing, fatigue, headaches, irritability, dry mouth. You can see some examples of what that would be there. Muscle aches, muscle tension, nausea, shortness of breath, sweating, trembling, and inability to concentrate. The consequences in long term would be a Crohn's disease, overeating and obesity, heart palpitations, higher risk of strokes, increased blood pressure, chronic respiratory disorders, insomnia, arthrosclerosis, muscle spasms and twitches, migraines, and ulcers. I put etc. there because there is also, you could get diabetes, you could have problems with your liver. So there is a number of things that stress could actually impact on your body. If you look to the right there, that's just an example of what that would be. Just plaque buildup could cause one to possibly have a heart attack. And these are my references that I used.